Okay, I'm proud to launch a World Immunisation Week in New Zealand on site in Hastings today with Te Tai Whenua o Heretaunga. Improving immunisation rates is one of the key ways we can protect our tamariki and whānau from a range of diseases, which is why this government has introduced a new target to make sure that 95% of children are immunised at 24 months. The World Health Organisation's World Immunisation Week provides us with an important opportunity to focus on this. It's fantastic to be here today with Te Tai Whenua o Heretaunga, one of the recipients of the funding to help deliver immunisations to whānau in their local area. Te Tai Whenua o Heretaunga have been working with East Coast communities for over 4 decades, helping individuals, whānau and communities achieve their own aspirations by giving them access to integrated health, educational and social support services and expertise. The new immunisation services delivered by Te Tai Whenua o Heretaunga and other providers will play a critical role in helping us to achieve our new childhood vaccination target. World Immunisation Week is very timely for New Zealand because winter is on our doorstep, and with that comes an increased risk of flu. We're also on the watch for other illnesses like measles and whooping cough. Our current vaccination rates mean we are at an increased risk of an outbreak if these illnesses get into our communities. Immunisation reduces the chance of infection, protects you from the more severe effects if you do get sick, and prevents you from passing diseases on to people around you, and helps protect the more vulnerable members of our communities. A range of immunisation activities are underway across the country for World Immunisation Week from 24 to 30 April, including community outreach events, kai and kōrero events, and pop-up mobile clinics. If you or your family members are due for a flu vaccination, COVID booster or childhood immunisations, I encourage you to get along to one of our events this week or to your local GP, pharmacy or health provider. I and this government backs immunisation. Kia ora mai tātou. Good. Thank you. Kia koe te raka kōrero.
Thank you. In the 2020 election, Judith...
Do you know what I just said to you? No, go
ahead. In the 2020 election, Judith Collins is party leader of National promised to replace Hawke's Bay Hospital, as did Labour in 2023. Does this government have any plans to upgrade or replace the Hawke's Bay Hospital?
Actually, Judith Collins and myself stood on the corner of Hawke's Bay Hospital and made announcements in the 2020 campaign. What I will say to the people of Hawke's Bay, in collaboration with their MP, Catherine Webb, that Hawke's Bay Hospital is a priority for me and for this government. It is currently forming a business case, the indicative business case, and as soon as that's ready and prepared, then this government will take it into account. But Hawke's Bay Hospital and the redevelopment of Hawke's Bay Hospital is a priority for me.
Well, would it be fair to say that when it comes to Hawke's Bay Hospital, there have been many promises from both National and Labour, and nothing has been done thus far?
It's been fair to say that over a number of governments and over a number of years that no substantial progress has been made. The progress that's being made here at the moment is the pathway that we have for national infrastructure, which starts with a program business case or indicative business case. That funding has been found, that seed funding is in play, and that pathway is in course.
There is a 7,000 staffing shortage across New Zealand in hospitals. What is this government doing about it?
We're doing a range of things. First of all, you saw with some of our immigration settings around the green list and turning on the pathway to residency, particularly for nurses. I am pleased that actually we have had a significant inflow of nurses, particularly internationally qualified nurses. And while there are still vacancies, it's much less of a discussion than maybe it was 6 months ago. You've seen us talk about a third medical school, which is a long-term play, of course, and the work we're doing to progress that. You've seen us put 50 or create 50 new medical school places for new doctors to come into Auckland and Otago, and you've also seen us fund and increase the number of places for nurse practitioners. There is a lot of work to do. I stand behind my statement that health workforce is the single biggest hurdle for the health system progressing and achieving the outcomes we need to achieve, and it will remain my #1 priority.
When the Paiora Amendment Bill was passed, which will raise the Māori Health Authority, what does that mean for organisations like Te Tai Whenua o Heretaunga?
What that means is there's the opportunity for them to be even more empowered through the Iwi Māori Partnership Board framework. What that means is that the ability to have strategic decision making in your area and follow it with funding is something that Paiora prohibited. I broke that and unlocked it, and will back Māori health providers to provide Māori health services to their local communities. A good example is with the organisation I'm with here today, who have benefited from the $50 million immunisation announcement that myself and the Prime Minister made before Christmas. And if we understand that, that was an announcement that utilises the very best, the magic I would put to you, of what Māori health providers can do, reaching out to remote, rural and vulnerable communities through immunisation. And you know, when they get to those communities, they will put a needle into a white arm just as quickly into a brown arm. They will serve a universal audience. And so we back Māori health providers and we put money behind our words.
Ngā mihi nui.
Ngā mihi kia koe.